Hi, diversity, equity, and inclusion is everything put together to fight against everything, stigmatization, and discrimination. This helped to create awareness and bring change as a core initiative of Town Meeting TV. And from our studios of Town Meeting TV, same as CCTV, we're coming your way with the program METE, meaning I am able, from the Ewe language in Ghana. Our topic for discussion on disability today is in the area of stigma and discrimination, how to overcome stigma and discrimination. Dr. Sefakor is the Director for Diversity, Equity and Inclusion at the College of Nursing and Health Sciences, UVM. She is an international disability rights advocate, a policy analyst for UN Convention on the Rights of Persons with Disability, a woman of color, and herself with a physical disability, which she's proud to stand and then help all persons with disability. Welcome, Dr. Sefakor.
Thank you, Auntie
It's
Salome.
good to see you.
Yeah.
Looking beautiful and colorful.
Oh,
Wow.
thank you.
Wow.
We kill to dress.
Sure.
We dress to kill.
That's right. Thank you for coming. Today we want to look at this important topic on disability, that is stigmatization and discrimination. The United Nations has multiple conventions on discrimination. Which one is for people or persons with disabilities?
Thank you so much for bringing me again, and greetings to our audience. Yes, we are on METE, I'm able, and talking about the UN conventions which actually protect us, people with disabilities. We deal with the United Convention on the Rights of People with Disabilities.
Okay.
In short terms, we say UNCRPD.
Okay.
That is the universal tool that is there as a bigger umbrella for every country to look up to build or to formulate their policies to connect with it. In other words, if we want to talk about Ghana, we have the Ghana Disability Law, or what we call Act 715. For you as a country to build your policies aligning with the UNCRPD, you have to look at the UNCRPD generally to connect with it.
Okay.
The purpose of the UNCRPD is to make sure that you promote, empower, and also make sure that make the people with disability have equitable access to every resources.
Okay.
So it's for the well-being, their total being, in terms of building that policy. As much as we look at it as an umbrella, we also try to be culturally sensitive to our cultures in our home countries,
Okay.
so that it doesn't seem like only that you are cutting and pasting from the US system or the UN system and just dropping on Africa. But anybody, any country working or fighting the rights of people with disabilities will definitely connect with the UNCRPD generally to build their home country policies.
Okay, so with your position and your vast knowledge and your advocacy for persons with disability, let's define it with all the knowledge that you have around it, put by the many conventions and other things. If we want to define, if somebody is watching us and really wants to understand what it means to say that I'm discriminating, or I'm being discriminated against, or there is stigmatization, please define those words for us. What is stigma? And what is discrimination?
So, stigma, I would say that stigma simply means creating barrier, or in other words, stigma is eliminating some group of people from the whole package, in a very simple term. And discrimination is also similar, or making sure that people don't have equitable access to what everybody has.
So if I understand,
So
stigma is the idea.
Yeah.
It's what in your mind to put in place, to put barriers in place.
Yeah.
But stigmatization is discrimination is the act.
The act, and discrimination, we can hold you accountable or responsible with policies in place. When you are discriminated against, we can use policies to prove to you that this is discrimination.
So that's evidence. That's what there is a proof that this person has been discriminated against. Okay.
Yeah.
Okay. And then so we now see the difference. So just give us examples from where you sit, that if somebody is being stigmatized, what are some of the things they will experience or they will go through for them to know that I am being stigmatized or I'm being discriminated against?
Yeah. It comes in different folds, again, knowingly and unknowingly, or consciously and unconsciously. Okay. I will share so many levels of stigma or discrimination that we face as people with disabilities from different backgrounds.
Okay.
My identity, as you know, I can talk about 3 strong discriminations that I face personally, which I have shared with the world in Amiable, which in a way of bringing people's mind to some of the practical things that are happening to us, but do not happen to the next person around you.
Okay.
So, as I said, it comes in different folds. A typical example is a person with disability can pass through the barriers, pass through the discriminations, survive it in the educational system, and then when it is time for that person to get the job that equalizes the
struggle, let's take it that way.
Yeah, or the position or the status where the person has gotten to. So for instance, I'm a doctor, right?
Okay.
And a PhD holder, we have some standard, let's say, in terms of the type of jobs that you get, you know that you will definitely be paid according to your certificate.
Okay.
Merit, right? As a person with disability, in some cases, you can have the certificate, you have qualified to have or hold that post, but because of your disability or because of other identities you have. For instance, I am a woman and I am a person of color, or I'm black and with disability. So because of all these packages around me, it is very hard for my fellow person with disability with these identities to get that job if 2 people are going for that particular job, and then they see your CV that you have PhD and somebody has masters, but it's of a different identity because of your disability and other things, layers around, that can disqualify you. And there, if you know, but around the table of discussion or the interviewers, you will not know. If you know that you were discriminated against because of your disability, there the policies will work for you or the law will work for you. That is if you know. Okay. So that is the place that I can connect to widely, that there are people with disabilities who have qualified. Now, let's go home. We have a lot of people with disabilities who have, the basic level of education that I know everybody has, which I have on my mentorship program. I have bachelor degrees, first degrees, and master's degree, but they don't have any job. They are there. They are qualified. They've gone through the hassles with the expectation that they will get that job, that they will live a normal life with dignity. They don't have it. When I come here in the US system also, I see the same thing happening. They happen to have different jobs which do not pay the exact amount that somebody also has the same certificate but doesn't have a disability.
Wow.
So the stigma is huge. But for you to be aware that we were 3 people going for this same position.
They all had the same qualifications.
Yes. The research shows that they take the very person who doesn't have anything on paper to have a disability. They will prefer to take that person to you because the assumption is they are going to spend money.
That's cost.
The cost, right? Because I remember I got a position in a university in the US system here. I remember very well. I was so there are stages of the interviews. I passed through the first 3 and I needed to go to their campus. So going to the campus, it puts you on that place that you normally they invite 3, the top 3. And as much as they invite them, they are going to pick only one, right? So on the day that I booked for my flight, everything that I was about to leave home, I just had a call that they just realized that I'm a person with disability. And the room that I was coming to stay, like my office,
doesn't have those facilities.
It's not accessible. Yes. They were very clear to me. But the policy here, ADA also, some part of it says that if you know that the cost of that retrofitting is going to be more than, if it's an old building, and it's going to be more than necessary, then there is no need of creating that accessible environment. That is one tweak of the policy, that if it's an old building that we have to do something which will cost more than the building, then we won't do it. So that was their place there. They are trying to connect to that. If they want to do anything about that building, where I was going,
it's going to cost.
It's going to cost them. So they were very plain to tell me that because of this, we would like to cancel your. And there I look at myself, and I'm like, okay, so it's because of my disability. It's not because of anything. I have the certificate, I qualify, and I have all the hours. You see? So at times, these are some of the things that people face or we face in the system based on the fact that there is a barrier created already, that we are struggling to penetrate or break down those barriers. And you have to actually know the rules or the policies, because when you don't know them, you are likely to just be tossed around. You are likely people will just trample upon you without necessarily connecting to you as a human being. If I want to talk about stigma for people with disabilities, there are a lot. So it was very interesting for me to know that as much as some people, some environments do not know how to live with diverse group of people, they prefer not to even have their CVs looked at. They prefer not to even read through their CVs to know their qualifications, because it is something that the culture that they just don't know how to take care of these type of people. So that is the culture of the organization. That's another thing, because there are some people with disabilities that I worked with before, is because of their place that they are coming from. One thing which was so dehumanizing to me, which I never thought about, that people could go that extreme and say, because of your dressing, your smell, because how you dress, your smell around you, because of how we don't seem to accept you or to connect with you, we don't know how to work with you. So because of that, we are likely not even going to look at this type of certificates or this type of CV. It happens. It is because you don't know. Because I found myself on a table with some people to interview people. And then as much as we are sorting out based on merit, I could see that we were sorting out not based on merit anymore, but based on names and based on abilities. and based, you get it. So that is how the layers are in terms of discrimination. So it depends upon where you find yourself and the type of the culture of the environment actually embrace or they are working with. You are going to be stigmatized in so many folds. The pain of that is double agony for us, as much as we are concerned. When you are a person of color, I have narrated my scenarios. A typical example is when I was robbed. When I was robbed in this book, right, chapter 16. The fact of it is, my friends who are Americans, they made me aware that this is discrimination. They were very clear to me that this cannot happen to them.
Wow.
Yes. People with disabilities who are what? Americans, white, they are like, it's because they know.
You're a woman of color.
Exactly. And that was my strength, because I got to know, and they proved to me with some policies like, this is what the law says, this is what they. So that was even the reason why I had to call the police. That was the reason why I had to deal with that, like with confidence that I know the law. I said, this is what ADA says, this is what the Americans, what the UN Convention says, that I should be also taken care of. Like this, as I said, it is the universal tool for every country. But the only thing that we know, which I want to just mention slightly, is U.S. hasn't yet ratified the UN Convention on the Rights of People with Disabilities.
Okay.
Yes, that is one thing that we are still working or advocating for U.S. to also ratify the convention so that it can work for people with disabilities outside the U.S. system.
Oh, okay. So if I'm hearing you clearly, knowing the laws, knowing policies is also incumbent upon persons with disabilities.
Yeah.
You need to know the law.
Yeah.
So what do you say when it comes to discrimination? Maybe somebody doesn't know. How can you well fit yourself and know that this is discrimination, this is not discrimination? Because sometimes people feel that there's some kind of maybe overreaction. It's like you hype it so much to mean like you have been discriminated against, but it doesn't exist.
Yeah, that's a good question. So we have, in my organization, we have series of workshops for people.
Okay.
And one of that is know your rights.
Okay.
That's a topic of knowing your rights. And what do we do in this? We walk them through from the UN Convention to the ADA. If they are Africans, most of the time, we walk them through what we call the African Protocol, and the African Protocol and their home countries' policies. Because that is the only place that they can be able to know the difference. That they can't, because let me just break it down this way, that most of us from other parts of the world, especially Africans, we don't even know that the laws can work for us.
Sure.
Because it doesn't work for us in our home countries.
So your national policy...
Yeah, connected to the African Protocol. And then connecting that to the UN CRPD. That is one level that we start from. We start, what are some of the things that you know from your home country that you can't do or people cannot do to you? For instance, when we are talking with a person with albinism from Tanzania, they know very well that what they are working on in Tanzania is how to survive, the right to live. Yeah, the right to live is where they want to dwell on, because they have been they have been butchering them or they have been killing them when you are an albino. So something like that, when you are an albino from Tanzania, I have to walk you through to let you know that in the US system, you don't need to fight for the right to live. You are living already.
You are alive.
Exactly. And this is the policy that you have to be looking at now. Now, maybe you have to look for the right to work, the right to go to school, the right to have health care, the right to all these things. So knowing your rights has to come from what rights do you know about yourself that you have as a person with disability. And then the next thing is, what are those policies that you can have on your fingertips. For instance, Article 24 of the UN Convention is about education. Okay, and when we come to the Americans with Disability Act, we look at education as well to see what they want, what they are saying about education. The reason why they need to know everything around themselves like that is, at times, people are confused if this policy or if this law is really working. So the main thing we say is, America, the system is working. Every policy that they say it's working, and then you have to learn some things about it. About housing, for instance, something about housing, we know our right to know when I am renting right now, what are some of the processes I have to go through with the landlord. Because in our context, we build our own houses.
Sure.
Yes, yours is to have the land.
The land, and you build according to your taste.
type. Yes, yeah. But here we have to we rent, and when you rent, and even if you are building your house there, that's another thing, mortgage and other thing. But most of the time, what are the processes or your right to have access to building or to have equitable access? When you have that house, it should be accessible, not only the ramp to enter and you get stuck in the kitchen or the bathroom, right? So those are the things that when the housing or the landlord says this place is for rent, when you appear as a person with disability, they can deny you, which happens to me so many times. Because they know the laws are working, they will tell you that, no, I can't give you this room. I can't take care of you because I'm not able to do this into this building. I can't fix it. No retrofiction. And that is one thing that every person with disability has to know, that you have your right, and then you have, they also have their rights as landlords.
At this point, as an advocate, would you say that there are so many ways in learning for now? Mm-hmm. So concerning all the basic rights for persons living with disability.
Persons with disability. We don't live with.
Yeah, sorry. Persons with disability. Should we infuse our policies, our national policies and laws for persons with disability into our education system? Should we factor it into our education system? Should we have a unit within our education system which will educate every person, not only people with disability, but all children, all students, all people going through every level of education, so that it doesn't mean like somebody will have to sit somewhere and be pushing for a policy to work. But then, as much as we grow in the coming future, we all have that knowledge already when we have to live in the society and the community.
Yeah, thank you so much. Actually, research shows in Vermont that Vermont, as much as we say we are very diverse, we are not able to serve our diverse community. That was research. And I passed through that research with some people, a team of researchers, and one particular thing that happened, we were trying to, and with the Human Rights Commission office, they were trying to fix the stigma of having different people in houses or in homes, right? Different cultural background. So they were looking for a person with disability, a person from other country, not from the US system in terms of accent, and a person who can speak English. So I happen to be the one going to do that. What are they expecting to do? They were going to let that person pretend to be renting, calling the house owners or landlords to actually request with my accent. They will know that I'm not American, right? And then I have to say that I'm a person with disability also. And those are the things that we were trying to really find solution for. So that was the purpose of that research. And that I couldn't perform the duties because of different things that happened, but somebody had to go on and perform that.
What was the outcome?
The outcome I wasn't part of it because I finished my program.
Okay.
Yes. So what I'm saying is there are systems, research backgrounds going on. There are findings. There are other things people are doing. NGOs also are doing, pushing. That holistic approach, I think if we work closely with every community, we can put everything together, which I always say in Ubuntu spirit, that if we can put all the things that we are doing in silos together, we will solve the problem for people with disabilities, especially because I know in our part of the work in terms of NGO, what we do also is to push for education. And when they are pushing, where I worked before, VCIL, one thing that we did was we used to go through all the school system to work with the students directly on self-advocacy and sit down with them that, hey, what does your teacher do in terms of when you are in class? And the teachers are there to listen. And we teach them how to talk about the process that they go through every day. And if that is helping them, yes or no, the teachers hear it from the horse's own mouth, right? That is the student and the teacher. And then we work with the parents also, that your child, you need to make sure that your child has access to this and this, or knows about the policies that we are working with. And then the community member, if that child has to work in an office or somewhere, we also empower them. So making sure that they know the law, it is actually not in the system, but we are advocating for that, like how we have history lessons, we have some courses they take. We should have what we call advocacy courses for people with disabilities, or self-advocacy courses that people with disabilities can take from the middle school to the top.
That's part of the curriculum for the education.
That is one thing that we are. So I would say that out of the advocate from movement, NGOs, and community leaders, where we have gotten to in UVM, specifically what I am doing, the courses that I produce or I develop, let me say I develop, not produce, they are all courses to meet the people in the community.
Oh, okay.
They are all courses to make sure that they are unique. You can't find them anywhere. They are courses that are coming out based on research done, and I am hired to create those courses. For instance, the Global Disabilities course, everybody takes that course across, right? Parents take it, professionals take it, not only the people in the university, outside the UVM system, health system, those who are working with students, and even outside the country, people take it. Ethical leadership for health professions, which I am currently teaching, is online. The same thing. Health professionals are taking it, Wisconsin, where they are from other places, to learn about how they can communicate and make what they see as a gap in their home countries or in their community. And practically, at the end of my courses, I want to see something realistic. I challenge them to do something as a project to report on in the community. So you choose your own community and a person with disability and how you are serving the community. So we are doing it slowly, but yes, as you said, for that to really come as a policy, that we will have a curriculum, and this is actually happening in the special education department, trying to make it work to connect to the teachers in the community, and then also the health system to connect to the professionals in the health system, right? So I would say that we are doing some setting some practical examples, but for the whole America to embrace that, to really look at disability as an international issue, because why we are concerned as NGOs at times or advocates at times is US is a leader in everything. US has the great leadership, and people look up to them to do so. The ratification of the UN Convention, which is not yet done, is a big gap for people with disabilities in the US. Americans with disability, when they travel outside right now, when you have a disability, the ADA ends at the border. It ends at the airport.
Sure.
When you are out, ADA doesn't work for you there. But if the US system ratifies the convention,
then it makes a more collective collective approach
Yes.
to it. We're going to help people around the world.
Yes.
Yes, I think it's great. It's great to have you, Dr. Sefakor, in the house today. And then I thank you so much, because the impact discrimination and stigmatization has not even just on persons with disability, but every individual, every human. It comes with a negative connotation, and we shouldn't accept it. And therefore, let's all join together and become so proactive towards abolishing and taking away. Let's do away with the tendencies of stigmatization and discrimination, and let's all live in a world full of love. This is how we want to end METE today on Town Meeting TV. We'll come your way some other time. Thank you.